SPK, and really specifically, you see her lids just look not great, especially for a 26-year-old. You're seeing a lot of scalloping, telangiectasia kind of throughout. The meibomian glands are all capped, and any meibum you can press out of there is pretty cloudy. And you're kind of surprised actually, because you're like, wow, this is a young, otherwise healthy young woman, but her lids look like they've been through something. So this is kind of just an example of some just kind of mild staining that you're seeing kind of inferiorly on the cornea. And you see your lids, so you decide to do meibography. A great tool to do meibography in practice is the LipiView instrument. So this is a meibographer that allows us to view the superior and inferior meibomian glands. And what's really interesting about this patient, when we talk about meibomian gland disease, especially in like older patients, we often talk about things like atrophy and tortuosity. This is a younger patient. You can see she has these sort of spots of atrophy, maybe potentially where she's had some of those recurrent styes in both of her left and right eyes. We can see some of the glands that are there look pretty robust, but some of them look like, they've seen better days. So based on all of that information I just presented to you, what would you say? She came in complaining of irritation. She wants to wear contact lenses, but what would you say her primary diagnosis is?
Yeah, so looking at everything, we see that this patient comes in and she has both symptoms of dryness and also signs. And then
Mhm.
signs, reiterating kind of what you said, was the vision. Her vision was a little bit fluctuating because of her unstable tear film. And then looking at the health, we see a lot of like meibomian gland issues. We're seeing the
Yeah.
atrophy, the tortuosity that we don't typically see in someone this young, which may be because of the Accutane use, because the
Right.
Accutane might target those sebaceous glands, like also in our eyes. So maybe that could be a culprit for that. And also looking at the telangiectasia, that may be
Mhm.
a sign of ocular rosacea, which
Yeah.
could also contribute to some of the inflammation we're seeing. Based on those findings, I would say that this patient has meibomian gland disease in both of her eyes, and that's probably causing a lot of that dryness and discomfort.
Yeah. Yeah. You're totally spot on. That's a great catch with the Accutane use, especially in this population. That is something that we might see a little bit more frequently. And it's so important to remember that what Accutane might be targeting is also what makes our eyes comfortable. Our meibomian glands are
Mhm.
a similar type of gland. So that's a really great point. So yeah, it's MGD is her problem. She has a lot, she could stand to have a lot of improvement in her lid health and her meibomian gland health for sure. Um, and what's really important to point out here is that meibomian gland disease in this case has caused her to drop out of her contact lenses, right?
Mhm.
The sequela of the poor meibomian gland health has made her unable to wear contacts. It's giving her these recurrent styes, which are so annoying from like a cosmetic standpoint and from a comfort standpoint, but it's also
Definitely.
impacting her vision as well. And I feel like vision is sometimes overlooked when it comes to, how dry eye or meibomian gland disease can impact sort of our quality of life. Here's another question. Do you think she is able to wear contact lenses? Do you think we can get her into something that would allow her to have comfortable contact lens wear?
I think eventually, yes. Focusing on that word comfort, it probably won't be the most comfortable right now, given that she does have a lot of inflammation. She doesn't
Mhm.
have a really good routine to keep up her lid hygiene or to reduce some of those symptoms of dryness. But if we target those first, then I think eventually, yes, she can be fit into a contact lens comfortably.
For sure, for sure. Yeah, I think that initially when you diagnose, especially pretty moderate to maybe even severe meibomian gland disease like this, especially in maybe a young patient who really wants to be in contact lenses, you're really tempted to say, let's start treating, but also I'll throw a lens on your eye. Um,
Mhm.
but knowing that meibomian gland disease is such a chronic, kind of forever condition, I like to kind of pump the brakes on introducing the contact lens and make sure we establish a really good treatment regimen or foundation initially. And then we can introduce contact lenses as we see the ocular health improve. So, my sort of steps or my kind of thought process for a patient like this, as I'm thinking about how she's going to achieve comfortable lens wear, is get that treatment plan, get the patient on board with the treatment plan, and then select a contact lens once we see improvement. So for this patient, what that's going to look like, and this always, I feel like with patients, this always feels like sort of the least exciting part is me kind of telling them, hey, I need to get you on the regimen. I need to change your habits so that you're doing things every day to help maintain and encourage good meibomian gland health. And that's going to start with lid hygiene and proactive lubrication. I know actually I've talked about this on Defocus in the past. I always talk to my patients about proactive instead of reactive lubrication. So making sure patients are putting in artificial tears, whether their eyes feel dry or not. So certainly you can use artificial tears when your eyes are feeling really dry in the middle of the day, but you should be putting them in at regular intervals to sort of establish a healthy tear film so that you don't get to those situations where you're kind of wanting to claw your eyes out. Education is super, super important at this stage because these patients are going to be using these treatment regimens, these easy at-home things forever. This is meibomian gland disease doesn't really go away. We just sort of keep it at bay and prevent progression. So we'll have a discussion and education about lid hygiene and proactive lubrication, but she is feeling uncomfortable. She's pretty uncomfortable today. And so we can do something to make her feel better today. She came into the office, feeling uncomfortable. So we need to make her feel better. And steroids can really help with that. So I can use medications to eliminate inflammation that's on the eye. Regardless of what type of dry eye a patient has, whether it's meibomian gland disease or aqueous deficiency or any combination of the two, inflammation is involved. And so if we use a steroid sort of in these early stages to help alleviate symptoms, to kind of wash out inflammatory factors that are on the surface of the eye, we're going to help any other treatments that we employ in the future have a better chance of taking effect and being efficacious. So there's different things or strategies you could use with a steroid here. I know sometimes depending on what market you're in, sometimes certain steroids are more accessible than others, or depending on what insurance a patient might have. You could hit her with a strong steroid like Pred Forte. We could do something like QID for a week and then taper off over the next week. I oftentimes do a 4 to 6 week taper with a softer steroid like Lotemax or loteprednol. Either would be appropriate, but again, the thought is that we're trying to just kind of do a clean sweep of the ocular surface, get all of the inflammation out of there so that her at-home treatments can be effective, and also so that if and when we introduce a contact lens, it's comfortable for her. So we're going to see her back in a couple of weeks. And if we see improvement, then we can talk about other treatment options and or introducing contact lenses. So we see her back a couple weeks later. She's just stopped the steroid, and she says she actually feels about 50% better. So better, or 50% better is better than 50% worse, right? So I'm going to count that as a success, but we've still got a long way to go. She's still interested in contact lenses, but again, I'm going to pump the brakes a little bit here on the contact lenses. We just stopped the steroid. I don't really want to introduce a contact lens that might kind of re-inflame the surface. Let's kind of maintain our at-home habits and maybe consider an in-office treatment today. Before we reintroduce the contact lens, think about something that we could apply or employ that would allow her to get continued relief. I oftentimes like to use a treatment like LipiFlow, a thermal pulsation treatment, after the patient has spent a few weeks sort of doing the initial cleaning in and around the eyelids. I feel like the patients can get a more bang for their buck if they, wait to use LipiFlow after they've done a little bit of at-home cleaning. And so she's in a great position right now to do LipiFlow, which is sort of going to be a deep clean of the meibomian glands and kind of getting any backed up meibum out of there. So we'll do that today. She might still want to be in contacts today, but I'm going to say, let's hold off just a little bit longer. I want to make sure we get that surface nice and calm, but keep doing the tears, keep doing the hygiene. I also feel like this message drives home to the patient, hey, this is important that you keep up with these habits. So this kind of slide is talking about why we're not going to try contact lenses today. Again, as I already said, sort of we're just kind of treating that surface and the lids with kind of kid gloves and making sure we're not doing anything to reignite or inflame the inflammatory system there. But when she comes back a few weeks later, she's still reporting improved symptoms. She's got great compliance with that lid hygiene and the proactive artificial tear use, which I would argue over the 6-week period, just having this repeated education and touch point of reminding her of
Mhm.
why that's so important has helped with that compliance. But she is like, I'm over it. I'm ready to wear contacts now. So this is when we're going to bring the contacts in. And this is where I'd like to bring Dr. Gaby in, because this is actually her patient. And so, Dr. Gaby, can you talk to us about how you might, after you've led this patient through this treatment process, how you might choose a contact lens for her and what factors you might consider as you're choosing that contact lens?
Yeah, so I think it's important first to understand that when we take a lens out of its solution, it's like a sponge. So it's fully hydrated. And as you wear that lens over time with normal evaporation, due to excessive computer use or ceiling fans, that lens is going to dehydrate. And where is it going to pull from? It's going to pull from your tears. So it's super important, like you guys had mentioned, to make sure that we treat the dry eye first prior than just fitting that person into just a contact lens that could possibly be okay but not 100, because we know that the most common dropout for contacts is dry eye or
Mhm.
discomfort. So the interaction between a contact lens and the ocular surface can have several ramifications. That contact lens disrupts that natural tear film dynamic, and what it does is it creates like a pre-lens and a post-lens tear film. So that partitioning of the tear film can result in an unstable pre-lens tear film, which reduces the lipid layer and tear film and then evaporation all over the place. So when I go to choose a contact lens for my patients who have irritation, dry eye, maybe they have some sort of systemic disorder, inflammatory disorder that predisposes them to dry eye, I always choose a daily disposable. And
Mhm.
actually, I'm so proud to say that 90% of my patients wear dailies. So it's
Awesome.
not just my dry eye patients, it's really what most patients are wearing, because most of us have some sort of irritation on the surface of the eye. And we know as optometrists that a daily lens is going to be more comfortable, it's lighter, it's thinner, it's really going to be the best option for our patients. The
For
next thing
sure.
that I do is I choose a silicone hydrogel. We know that silicone is resistant to moisture loss. So these lenses tend to stay more moist over time, and they also deliver more oxygen to the cornea. And also, there's certain contact lenses, like my favorite one currently is One Day Oasis Max. It has a certain wetting agent called PVP. And the way that this lens was designed was that the PVP is more dispersed throughout the lens and on the surface of the lens. So it basically helps retain the moisture of itself. So it's not sucking out the tear film of the patient. And lastly, what I consider too is the coefficient of friction, which is something that we don't always talk about when it
Mhm.
comes to contacts. It's also known as lubricity. So, this is how lubricious is the surface of the contact lens. And if it's lower, it's going to help give that like silky, smooth feeling. Because if we have excess friction with the contact lens, it's going to lead to contact lens intolerance and discomfort.
I love the word lubricious. That's great. Way
Yeah.
to drop that in there. I love that. Yeah, such a good point to kind of be familiar with the sort of hydration systems or wetting systems that are associated with the lenses that you are suggesting to your patients. I think it's easy for us to, maybe our rep will come into the office and we're busy and they start saying what's special about their lenses and you're kind of like, well, yeah, yeah, whatever. I like this one in my eyes. But it is so important to listen to that and kind of digest what that means for your specific patients and how that might impact their vision and comfort with the lenses. And so I love how you described the sort of wetting system and lubrication system in Max, because it's important for you to know that. And
Right.
also it's so important to be able to tell your patient, hey, this is why I chose this lens for you. Especially in a world where our patients can go online and get get who knows what off the internet, it puts so much value in them coming to you each year when they're having problems, for you to say, hey, I'm picking this lens for you because it has this, this, and this is going to serve you well. So I think that's such a great point.
Yeah, that's very true. Every contact lens wearer needs to be managed individually. So it's
Yep.
really important for us to assess their needs, their motivation for wanting to wear contact lenses, and their ocular and systemic health, because it's really important that we need to be able to concurrently manage their dry eye, as so that they can continue to wear their contact lenses. Because if not, eventually that patient is going to drop out. And we know that patients who wear contacts are more compliant with their eye exams. So they're going to be the ones who come back to us year after year versus patients who just wear glasses. And I think if you lead with the best contact lenses out there that are going to be the most comfortable, you're going to get more referrals to your office as well, because that patient is going to go to their family member or their friend and they're going to say, hey, Dr. Olivares fit me in this amazing lens. Like, you can wear contacts too, because you don't understand how many people I see at my gym wearing glasses at CrossFit. And I'm like, this is embarrassing. You're not to wear those glasses during this gym class. Come to me and I will guarantee I'll fit you in a comfortable lens. And most of the time they say, I can't wear contacts. They're not comfortable. And it's because they just haven't tried what's best and the newest technology that's out there.
Yeah, that's such a good point. And like you said, if they drop out from a practice standpoint, you're never going to see them again. But like with a patient like this, she's 26. If she comes to me and I manage not only her dry eye, but then also I'm her contact lens prescriber, she's a patient for life, and she's going to bring in friends and family. And when you think of it solely from a practice building standpoint, that's so impactful.
Amazing.
And again, you're doing something so valuable for her. You're not just treating the dry eye. You're not just throwing a random contact lens that you like at them. You're being thoughtful about both her dry eye management and her contact lens care, which is the whole package. And it's what we should all be doing. But I think most patients, as your friends at the gym probably illustrate, like, are not getting that kind of care everywhere they go. And so it seems obvious and easy, but not everybody's getting that care. So we need to just be thoughtful about how we're doing that.
And what you said too, this patient, and I think I showed you the review that this patient had put about our visit together. She had said that she was so depressed with these concurrent, these styes that just kept coming up. And I mean, this is a young, pretty girl who, she's a bartender. So, she's got to be looking well for her, her clients. And it was really, really nice that she came back to me and she was like, listen, no one did what you did. And actually, after we had done LipiFlow, she has been back since then. And I did mention some comments about IPL. We did do IPL on her. We did do radio frequency on her. So she's then very, very happy, and she's been able to wear her contact lenses. So it's been pretty awesome.
Amazing. Yeah, she's definitely like the ideal candidate for IPL. And hopefully that'll keep her much healthier kind of long term. Yeah, all that telangiectasia is just asking for it. Yeah.
Yep. Very true.
Awesome. Well, maybe we can bring Daryl back into the conversation.
Thank you for bringing me back.
Yeah. What do you think, Daryl?
Fantastic conversation. I mean, this is next level, right? I mean, we're getting into the science of dry eye. We're using instruments, equipment to really get in there and take care of the dryness. I learned a lot, and I have a couple of questions for you, Dr. Gaby. Number one, I thought I was, representing and doing a fantastic job with about, 75 to 80% of my patients being in dailies.
And that's really good. That's really high.
That's really good.
Is amazing though, right? I mean, that's like 9 out of 10 patients walking through your door that are being fit with dailies. The question that I have for you is, how do you present this to your patients? I know with your dry eye patients, it's a no-brainer, right? Just due to, some of the things that you touched on earlier, but what kind of conversation do you have with those patients when they're in that chair?
Yeah, so I think that when I visit different doctors' offices and I have different lectures, and I think the most important thing that I can get across to their doctors is to make sure that you're speaking confidently. Because if you're confident about what that patient needs, they're more likely to understand, right, and want to go for it or spend the extra money for these contact lenses that are a lot more expensive than frequent replacement lenses. So what I say, I can tell you a story. I had a patient a while back that was in a monthly lens, and he came to me and he was like, I love my monthly lenses. I want to stay in these lenses. I just need to get a little bit clearer vision. So I said, okay. I was like, hold on. There's a new lens that recently came out on the market. It's very comfortable. It's lighter. It's thinner. It'll deliver more oxygen to your eye. And overall, it's going to allow you to see better and more comfortably. I really want you to try it. And he was open-minded and he was like, sure, let's try it. So at our practice, we always have patients back for a 1-week follow-up so we can make sure that they're not buying their contacts online or they're not calling us for their prescription. So that visit that is supposedly a follow-up, goes from a non-paying visit to that's when we sell them the year supply of contacts. So when he came back for his 1-week follow-up, he was wearing his monthly lenses. And I was like, oh no, he didn't like his dailies, right? I failed. But he sat in my chair and he was like, I'm wearing my monthlies because I want you to try to tweak these, but those dailies were great. I mean, I tested myself like this. And, we hate when our multifocal patients do that.
Yeah.
And he was like, I just loved it. I saw great at all distances. So I tried to do an over refraction on him and I was like, not able to get him better at all. He was seeing the exact same. And I said, sir, you're comparing, 20-year-old technology to something that's brand new. You can't compare the two, So I just think it's really how you speak to the patient because they're there for your expertise. I see this all the time. Doctors saying, oh, would you like a monthly lens, a 2-week or a daily? Take your pick. That's not the way you do it. When you go to a cardiologist and they're prescribing a medication for you, they're not saying, hey, do you want this medication that can maybe prevent a stroke? Or do you want this better medication that will definitely prevent your stroke? So it's just like, I really think it's how we talk to our patients. And we also, as optometrists, we don't want to seem salesy because obviously we're always, there for our patients' best interests and healthcare, it all comes first, So I think it's hard too because in school we don't really learn how to really prescribe from the chair and how to recommend products sometimes to our patients.
Yeah, I love that. And the thing that I really love is confidence, confidence, confidence. And there are new graduates, there are students that's listening to this Grand Rounds event that we're having today. And the best way to build confidence is number one, try the product, right? Try the lens, see what it feels like, get that confidence, be able to talk about it firsthand, then also create ambassadors in your office. If you have team members, your front desk, your eyewear consultant, your technician, make sure they're wearing the contact lens. Let them try it out because they're going to talk about that lens more. So the more ambassadors that you can have, the more knowledge that you can have, the more you listen to Grand Rounds. When you go into that exam lane and you prescribe from the chair, you're prescribing the best solution for that patient, and you're going to be confident about it because you have all the knowledge and the team around you to support you. So I think that's a great call out, Dr. Gaby, that you have to have confidence. Never go into that exam room being unsure about something. If you are unsure, step out the exam lane, go look up something, phone a friend, do something, but never show that you don't have confidence in front of that patient. They do not know what you do not know, right? But at least if you don't have an answer, go outside of the room, figure it out, contact a colleague, a mentor, phone a friend, whoever it may be. That way you can go back in there with a big smile and be forever confident because that's a major deal there. I appreciate that. Now,
thank you, Daryl.
I had another question for you. This is a big deal, and especially for students because they're not used to this. When you have a patient come in and you see that they have dry eyes, you see that they have meibomian gland dysfunction, how do you pivot that conversation in the exam room that, okay, this is no longer a comprehensive eye exam. This is a medical office visit. What kind of dialogue takes place in that exam lane, or what kind of dialogue takes place before the patient even walks into the office? Because I feel like that's one of the things that the students will get kind of hung up on and not know what to do and try to do everything all at that exam. So what do you typically do in those situations?
Well, I think it's important to have good front desk, right? Because they will take the calls and make the appointments. So they should be the ones to screen those patients and decide if they're going to be using their medical insurance for a medical office visit, or if they're going to be using their vision insurance for a vision exam. But, there are some patients that kind of fall through the cracks. And, I just sit the patient down and it's weird because no one's ever said to me before, hey, wait, why, this isn't a comprehensive exam, you're doing a medical exam. I think that they know why they're there, and if it's for flashing lights and floaters, I'm very much able to just change the exam to a medical visit because that is why they're there. But I've never had someone get upset at the fact that we couldn't do a comprehensive eye exam because I wanted to first, nail down their chief complaint, which could be a medical complaint.
And I
Right.
think you nailed it. You hit the nail on the head. I mean, it's all about that front desk, right? If they're able to filter those out and collect the medical insurance at the top of the visit, that makes a game-changing visit for you, right? Because you don't want to be that doctor in that exam lane that has to explain all of that stuff. And that's why it's important to invest in your team, work with your team. If you're a doctor, you're not too big to go up to the front desk and see what they do. Learn everything that they do. Know that patient journey because it's only going to help you better or make you stronger in that exam lane when you're, prescribing the solutions and having that conversation and trying to put all the pieces together for the patient. So that's a great call out. I have one last question. You mentioned athletes. I used to be a big sports person, but now I'm married. My wife likes reality TV, so that's all I watch. I don't get to watch.
Same. Sounds familiar.
Look, I can tell you everything about Married at First Sight. I can tell you everything about the housewives and all that other stuff. Right? It's a hot mess of a household. That's all I can say. But you brought up athletes, and I'm curious to know when you have an athlete versus a non-athlete, these products and solutions, especially that Max, do you have a different conversation or is it still the same conversation with all these different walks of life? Because it seems like this lens is pretty powerful and it can really accommodate the needs for a lot of our patients that walk through the doors. But I'm curious to know, what does that conversation and that exam look like with those patients?
Yeah, so I love that question because no matter who steps in through that door, I don't judge them on what shoes they're wearing, what purse they're carrying. I will fit anyone and everyone in the latest technology, right? And everyone has some sort of disposable income. So it's not for me to decide as to whether or not they want to spend it on their vision and their eyes. So when it comes to glasses and contacts, I'm always recommending the best quality, the newest, latest technology that's out there because I truly feel like that's what's going to help me get more success, right? And more referrals to the practice. And let's say the patient comes back for their 1 week follow-up and they're like, listen, the lenses that you fit me in, they're amazing. I love them, but unfortunately, I just can't afford it this year. It's the seed that I have planted because there have been many times where that patient comes back in a year and they're like, remember those contact lenses that you fit me in? I am ready to wear those contacts this year. So, we're constantly upgrading our phones and our computers and our technology. So the eyes should be no different. Your patient is coming in and spending money on a contact lens fitting every single year. Make it worth it to them. I can't stand when doctors are like, if it ain't broke, don't fix it. It shouldn't be the case.
I know.
It's really important that we show our patients that there are possibly better, contacts or better lenses out there for them. So I'm constantly upgrading and changing my patients and allowing them to try the latest products.
I love it. And the only person that I tell if it's not broken, don't fix it is my wife. Everyone else, just go ahead and fix it and get it rolling,
Yeah. Makes sense.
So, Nicole, you're the student on a call. I mean, how's this conversation been? Has this really helped, you elevate in that exam room? Do you feel like you've gotten some tips and some pearls to really take it to the next level tomorrow when you jump into the exam lane?
Oh, definitely. I feel like it's great to hear how we not sell contacts, but how we offer like the greatest technology to our patients. Even though it's expensive, it's worth it so they can have like a better quality of life. And I really like that kind of aspect that we're able to help patients see better and also live more comfortably.
I love it. I love it.
Love it.
Dr. Erin, any last comments or tips before we jump into the gift cards?
No, you guys covered it. I really liked hearing all of Dr. Gabby's kind of pearls and experiences. So that was awesome. Thank you.
Awesome. And Dr. Gaby, any last words before we jump into the raffle?
We're good. Thanks so much for having me, guys.
Yeah, for sure. So let's go ahead and name the winners. All right. So we have first up, Marion Malig is one winner. Number 2 is Molly Hughes. And number 3 is Avia Dolberry. So those are the 3 winners. You will get an email from my team tomorrow with the Amazon gift card. Thank you so much for tuning in. We have another event coming soon, May 13th. It'll be the last one for this series. Again, I want to thank Johnson & Johnson Vision for really holding us down and making the magic happen. Again, it's very important to partner with folks that want to take care of the profession, to partner with folks that really have the cutting edge technology to help accommodate your patient's lifestyle needs, but most importantly, to have healthy eyes. And when it comes to that, Johnson & Johnson has really done that. Super excited. Dr. Gaby, you dropped a lot of gems on us. For everyone out there, we just want to say that it's important to make sure that you always stay confident. Want to make sure that it's always important to offer the latest and greatest technology. And most importantly, make sure that you take care of your patients and give them what they need. They're coming to you because you're the expert. And if you don't act like the expert, you're going to lose a patient for life. But most importantly, you're going to lose a patient to eye care. And we always want to represent and make sure that our patients have all the right tools and resources to be successful. Until next time, stay healthy, stay positive, and stay blessed. Peace. All right, colleagues, and it's a wrap. Thank you dearly for hanging out with the D-Focus Media team. We hope truly something resonated with you. And if it did, be sure to give us 5 stars and make sure you follow us on all social media platforms: Facebook, Instagram, Twitter, LinkedIn, you named it. And our handle is at D-Focus Media on all platforms. And until next time, be sure to keep it 2020, and we look forward to seeing you on the next episode.